Why is one testicle more wrinkled than the other? Missing fingers, wrinkling nether regions, and just how many mosquitoes would it take to finish a person off? What? Today, I am breaking down and answering some of your wildest medical questions from Discord. Brace yourself, this combo might get a little out there. All right, let's dive right in. Is it okay to eat my toenails? I've actually tried it too many times to count, but it does taste good to me.
The look of it, the taste of it, the smell of it.
So your toenails are made of keratin. Think about this. Your fingernails and your toenails are still intact after you've died. The likelihood that you're actually breaking it down within your gastrointestinal tract is pretty low. You can actually cause scrapes into your throat or your esophagus. If you're biting and then you increase the risk of getting infection to the toe itself, I would highly advise not to do that. Why is one testicle more wrinkled than the other? I'm assuming the scrotum, because usually the testicles are smooth and then they have the epididymis on the outside. Now, if you're feeling in there and you're feeling maybe like a bag of worms, then maybe you need to get it checked out. And there's something called varicoceles where there are actually blood vessels there that shouldn't be there. But you have your scrotum, aka the sac or the outside, your skin changes shape depending on temperature. As we get a little bit older, they hang a little bit lower. So the testes, aka both testicles, are outside of our bodies, basically making it tighter or more loose. So as it gets tighter, it could get more wrinkled. And sometimes it's actually, at the beginning, might be that one side is actually more wrinkled than the other, but shouldn't be permanent. So if you're having any wrinkling of what you believe is your testicle, definitely get it checked out by your doctor and then possibly have an ultrasound done. How many mosquitoes would drain human into severely losing blood? We're talking about so many mosquito bites that you would lose blood and die. So then you'd go into hypovolemic shock, which when you lose so much blood in a short period of time, your body does not have the ability to compensate in that time to perfuse all your vital organs, your heart, your lungs, your brain, your kidneys, and they ultimately fail. A mosquito usually feeds or has a meal of about 5.5 microliters of blood. A human on average has about 5.5 liters of blood. So if the mosquito is drinking a little bit of your blood cocktail, you're gonna need about 1.1 million mosquitoes to bleed you dry. That's a lot of mosquito bites. Rest assured, they're unlikely going to drain you of all your blood. We see often that paramedics use epinephrine during cardiac arrest. Now, if for some reason I'd have an EpiPen around, would you recommend using it during first aid before paramedics arrive? Probably hold off. Obviously, if you're in the middle of nowhere in the wilderness, it's a different story. But if paramedics are on their way,
Help is on the way, dear!
typically giving an IV injection of epinephrine versus IM, which an EpiPen does, would be much better because IM injections are variable about their bioavailability and how much is actually quickly getting into circulation. It's just the absorption rate is different versus if you're getting it directly into the bloodstream. If you're in the middle of nowhere, no medical help, and somebody is in confirmed cardiac arrest where you are a pulseless, not breathing, and you're trying to help, it could be something to do. Is it safe to drink your own pee in the desert, or is it dangerous? So we've all heard this or seen movies about it. It's not advisable to do this. Basically, the point of your urine is to get out toxins out of our body, to filter out what we don't need. There's byproducts and waste. Yes, urine is probably a lot of water, but it also contains like urea, which if we re-ingest it, you're actually going to tax your system even more and make your kidneys work even harder to then refilter all this stuff back out. Not advisable even in this desert type situation. I find it strange looking at the debris in the cracks of my nipples. What is it? Debris in your nipples. Okay, so cracks in your skin or your nipples could be fissures. Runners get it often. Surfers, anybody who gets chafing or a lot of rubbing to that area can cause some cracks in the skin, and they're open wounds at that point, so you want to treat them like that. Cover them, make sure they're moisturized. If they have any signs of infection, you want to cover it with topical antibiotic ointments. If it starts looking weird, has a funky smell, starts oozing, it needs to get checked out. We should have nice, clean, clear skin Guys who can move their penis when erect without using their hands, are they doing Kegels? So Kegels are a term that we use for exercise using the pelvic floor muscles, contracting muscles such as like your pubococcygeal muscle, or maybe they're just swinging it around. Yes, the erected penis could potentially move. Even if you're doing it with a flaccid penis, the area could potentially still move around a little bit. If you are going to urinate and you're midstream and you want it to stop, those are the muscles that you're contracting to get it to stop. Why do I barely have hair only in one armpit? It could be genetic factors, or it could be underlying medical conditions like, say, asthma, kidney disease, diabetes, maybe abnormalities related to your pituitary or your thyroid glands. Think about it this way. Some people might have very hairy armpits and some people have minimal. Just like when a kid is born, sometimes they have a full head of hair and sometimes kids come out totally bald. But obviously, if it's concerning to you as an individual, get it checked out. Have a discussion with your doctor about it. Have them take a look at it. Maybe there's something in the way blocking it. Again, many different reasons. You need to have the conversation with your doctor. Does having too many birthmarks mean that the parents are related in some way? They happen by chance. They could be inherited and you could have some similar, but does it correlate that the parents themselves are related? No. Now, there are different types of birthmarks. Nevus simplex, nevus sebaceous. There's also strawberry hemangiomas. Do go to the dermatologist and get them checked out just to make sure that there's nothing that's growing, looking funky or abnormal that would be concerned that it might be cancerous. Do you guys have any birthmarks out there? Let me know in the comments below. Is it okay to drink water from a river? Did it 5 months ago and nothing happened. So I'm glad nothing happened. I've done that before in the past where I drank water off of a glacier. It's water in the environment. It's not filtered. It's not purified. You run the risk of it having some microorganisms in there, including bacteria, viruses, parasites. So you do increase the risk of having waterborne illness and diseases occurring, which typically means diarrhea, nausea, vomiting, develop worms. There are companies that make a water purification to clean the water that way. Hey doc, if you hypothetically had to lose a finger, which one would be the worst and which one would be the best? Please don't lose any fingers.
Ah! My finger!
But think about this. Probably the middle two fingers here. So either your middle finger or your ring finger would probably be the best one to potentially lose. Your worst one you probably lose probably be your thumb. Thumb is really important. Your pinky, you'd be surprised, it holds a lot of strength and helps with holding objects, and then also your index finger. But please don't lose any fingers. Why is the back of my head flat? Flathead syndrome usually occurs early in our development when we're little babies and we're not rolling around ourselves and our head is rested on a flat surface. Our skulls can actually conform to that flat surface because it's very malleable. The sutures of our skull are opened and still growing, so it can be flat at that point. If you're a little bit older where your sutures are still open, you can do some type of reshaping. Now, does it affect anything, doing anything? No, everything functions fine. You just have a flat spot on the back of your head. Very good questions from Discord. They never cease to amaze me. The things that people think of and are wondering and maybe don't want to ask their doctor, so they ask me online here. I'm glad you guys feel comfortable sending questions. Please keep them rolling. And if you guys enjoyed this, definitely check out this playlist right here. And as always, do me a favor, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.